experience. And I happened to get a good example of that. So I went with one of our community health outreach workers nearby to her home visit. And this is part of, we have a grant for an asthma program. And so went with Carla to her home visit. And what the community health outreach worker does is they're doing a quick intake, see if the person is taking their medications, but then looking around in the house to see if there are signs of triggers for asthma. So looking for cockroaches, looking for dust and other sorts of allergens. And of course I had permission the patient gave permission. But what was so amazing about this visit, and I'll get to answer your question, is this woman, her friend in the building knew that the Lowell Community Health Center outreach worker was going to be there today. So her friend came downstairs. I don't even know if I told you this part of the story. Her friend came downstairs to meet us because she too was having difficulty breathing and thought it might be asthma, and she's not a patient of the health center. And we were with a community health outreach worker and a community health nurse. And so in just moments, we have 2 intakes going on. And in that moment, we were able to, terrible word, but capture that second woman and explain to her that if she wanted to be in this asthma program, she needed to be a patient of the health center. And they booked her an appointment and got her. And so now she's assuming she shows up for her appointment, she is now connected to care. And I just thought that to me is that's what you're looking for when you are in community health. So they went into this one woman's home, and now they're helping 2 women.
I think, and Sue, you can speak to this. I think a big thing that we did was the Meta Center, and if you could speak to that, talking about how we break down walls in the community.
Yeah. So